Mr. President, as someone who grew up in rural South Dakota, in the town of Murdo, which has a population of roughly 500, and that would be rounding up, I know firsthand the joys of living in a rural community. I also know some of the challenges. Everything from package delivery to internet reliability can be more difficult when you live far outside a major city. And access to health care can sometimes be a real challenge. More than 100 rural hospitals have closed over the past 2 decades, and doctors can be few and far between in rural areas. Thanks to the Working Families Tax Cuts legislation, however, help is on the way. Republicans' legislation created a $50 billion rural health transformation program to address the rural health care crisis. Instead of a top-down, Washington-directed approach, we are giving states the resources and the freedom to find solutions for the particular challenges in their state and to find sustainable ways of ensuring rural health care access in their communities going forward. And the response has been robust. Every state in the Union, red and blue alike, has applied for and been approved for funding from this program. And states have big plans. The Texas Tribune reports, and I quote, "The state's health care agency said it will use the funds to strengthen rural health care clinics in a variety of ways, including creating wellness and nutrition programs to rural providers, educating and attracting health care professionals to work in rural areas, and modernizing resources and technology in rural centers. More specifically, it plans to add more than 1,000 rural health care positions with the additional funds," end quote. Another news article reports on Ohio, noting, and I quote again, "The state's proposal focuses on addressing barriers to health care by building on existing state investments to expand access to care, strengthen the rural health workforce, and modernize facilities and technology," end quote. Georgia will be using rural health transformation funding to upgrade technology and invest in its rural workforce. North Carolina will use the fund to, among other things, support more than 400 rural health facilities. And Mr. President, the list goes on. My own state of South Dakota will be using its funding to invest in a number of priorities, including a major investment in telehealth, which can be a key way, I should say, to access health care for those in rural areas. South Dakota will also be using its funding to create regional hubs for emergency services and improve access to maternal and infant health to ensure the delivery of essential medical care. Mr. President, back in June, a few months before Democrats tried to repeal the Rural Health Transformation Fund, the Democrat leader said, and I quote, "This little fund to help reimburse rural hospitals is just a fraud," end quote. Well, he should tell that to his state, Mr. President, which applied for the program and received a $212 million grant. And that's for 2026 alone. When the state announced its application, the Office of New York State Mental Health Commissioner Dr. Ann Sullivan stated, and I quote, "Expanding access to services in underserved communities is an important part of our effort to strengthen mental health care statewide. The Rural Health Transformation Grant will help New York State explore new partnerships, build our health care workforce, and pursue innovative opportunities to expand care in these areas," end quote. Let me repeat that, Mr. President. The Rural Health Transformation Grant will help New York State explore new partnerships, build our health care workforce, and pursue innovative opportunities to expand care in these areas, end quote. Well, Mr. President, that doesn't sound like fraud to me. Perhaps the Democrat leader would have preferred his state to miss out on these resources. Perhaps he would disagree with the Democrat governor of Hawaii who said, and I quote, "As a relatively small state, this will help us a lot to keep our hospitals open, to make sure there are providers available to have telehealth available," end quote. Well, Mr. President, the Democrat leader can spread all the disinformation he wants. The Rural Health Transformation Program is in effect and every state in the Union is benefiting. And Republicans will continue to work to make health care more affordable and accessible for American families. I want to thank Dr. Oz and his team at the Centers for Medicare and Medicaid Services for their tireless work to get this program up and running on an expedited timeline. And I look forward to seeing all the ways this program will help transform health care in rural America.